The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and welcome to Webinar Wednesdays with SMP. We're glad to have you all join us this morning to learn more about how you can protect your Medicare from scammers. My name is Sunny Lawless, and I am the Assistant Program Director and Volunteer Coordinator for our SMP programs. Joining us today will be Brenda Garrett, who is one of our Community Outreach Specialists in Georgia, and Johnetta Red, who is our Complex Interaction Specialist for all 4 states. And today for the March installment of Webinar Wednesdays with SMP, it's all about protecting my Medicare from scammers. So we're going to teach you ways to protect yourself from becoming a victim of Medicare fraud. During the presentation, you're welcome to type in any questions you might have into the chat, but we're going to hold those until the end of the presentation when we open it up for Q&A. Before we get started with today's presentation, I do need to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. And if this is your first time joining us for a Webinar Wednesdays, we want to give you a little information about who Senior Medicare Patrol is. Well, SMPs, as I mentioned, were grant-funded projects of the Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own Senior Medicare Patrol program. In Georgia, Louisiana, Mississippi, and Vermont, SMP is sponsored by AdviseWell. And the mission of the program is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before we get started with today's presentation, we do have a quick polling question for you. And today's question is, has anyone ever called you and asked you for your Medicare or your Social Security number? So we'll go ahead and launch the poll. And again, it's, has anyone ever called you and asked you for your Medicare or Social Security number? And if you will, go ahead and punch in your answer, yes or no. And I'll give everyone just a few moments to do that. All right, just a few more seconds. Please go ahead and lock in those answers, yes or no. All right, we're going to go ahead and close the poll and share the results. And it looks like 71% of you said no, you've never received those types of phone calls, and 29% of you have said yes. So I'm going to turn things over to Brenda, who's going to tell you why, when they call, you should not give out that information. Brenda?
Thank you, Sunny. Good morning, everybody. So let's talk about calls from scammers. Many Medicare recipients have reported receiving calls from scammers who claim to represent Medicare, Social Security, or a Medicare Advantage plan insurance company. We receive many reports of these types of calls on our toll-free hotline number and during our outreach. The caller claims that new Medicare, Social Security, or Medicare Advantage plan benefits are being rolled out. Some callers state that Medicare is sending out new plastic cards and they need the beneficiary's information to send out their new cards. Next slide, please. The scam artists may even have the limited information about the beneficiary, name, address, or sometimes even a date of birth. The caller may be extremely aggressive, calling multiple times or threatening the beneficiary with the loss of benefits. The caller may promise that they can improve the benefits that a beneficiary is receiving or decrease the cost of their insurance. They will say anything to obtain your personal information. Next slide, please. On the previous slide, we mentioned that the scammers sometimes already have limited information, such as the beneficiary's name, address, and birth date. So how do they know so much about us? Let's take a look at some of the methods scammers may use to steal your information. Hacking and data breaches. Data breaches are something that we keep hearing more and more about. Malicious hackers can target organizations that store large amounts of personal data like banks, email providers, online retailers, healthcare providers, so on. Once your personal details are leaked in a data breach, they can be sold on the dark web. Scammers might also get information about us through government records. Personal data like criminal records, property owner information, and other public records are freely available. Anyone can legally gather this information on you and sell it to others, including the scammers, and it's 100% legal. Next slide, please. Another way scammers learn so much about us is from us. We give away reams of personal data if we participate in surveys and contests or fill out product warranty cards on paper or online. All of this data can be sold to others legally or as part of a scam. Selling survey data is big business, and marketing firms and even criminals can learn a lot about us. We share personal updates on Facebook. Scammers turn to social media posts to learn more about those they have targeted. If you disregard or recycle sensitive documents like bank statements or utility bills without shredding them, beware. Fraudsters can raid your trash to salvage your personal data. You should shred all mail that has your name, address, account numbers, and/or other personal data. Next slide, please. Now that we've covered how scammers know so much about us, let's discuss what can happen if scammers steal your Medicare information. Here are just a few examples. You can become a victim of medical identity theft. You may be denied medical services or equipment due to a compromised Medicare number. You may have inaccurate information on your medical records, like false diagnosis or inaccurate lab results. Medicare may be charged for services or equipment that you do not need or never received. You may be financially responsible for medical services or equipment that you do not need or never received. Next slide, please. Let's take a look at what you can do to help stop Medicare card scams. These are so important. Do not answer calls from numbers you do not recognize. Do not confirm your Medicare number or answer yes to any questions. Guard your Medicare card and number like a credit card. Don't share your card, laminate it, make copies, or let anyone else make a copy. Don't share your Medicare number with anyone who contacts you by telephone, email, or in person, unless you've given them permission in advance. Medicare will never contact you for your Medicare number or other personal information. Don't ever let anyone borrow or pay to use your Medicare number. Next slide. If you are looking for a new Medicare Advantage plan or enrolling in Original Medicare, remember the following. There is no such thing as early bird discounts or limited time offers. Don't let anyone rush you to enroll by claiming you need to act now for the best deal. And be wary for free gifts, free medical services, discount packages, or any offers that sounds too good to be true. Next slide. Use caution. The Centers for Medicare and Medicaid Services and the Social Security Administration will never call you to update your information or give you a new card. If you receive a call from anyone asking you to verify your Medicare or Social Security information, hang up the phone immediately. Do not answer any questions from a caller that you do not know. Next slide. Now I will turn things over to Ms. Janetta, who will share the 3 keys to success in preventing fraud, errors, and abuse.
Thank you, Brenda. Okay, the 3 keys to success. Our first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Share your Medicare number only when necessary, such as at a doctor's office or if you go to your pharmacy. Only carry your Medicare card when you know you're going to use it. Remember, Medicare will not call you or ask you for your Medicare number for any reason. Keep records of all medical visits and procedures that take place, and also keep records of any medical equipment that you may have ordered. Next slide. Okay, the second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare Summary Notice, also known as an MSN, or the Explanation of Benefits, also known as the EOB. Your Medicare Summary Notice is mailed to you by Medicare every 6 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Compare your statement to your personal records and look for the following items: medical appointments that you did not attend or were double billed for, medical equipment such as braces, catheters, or diabetic supplies that you did not order or receive. Next slide. The third and final key is report. If you suspect that you've been a target of fraud, report it. This will help you and others at risk from healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to Senior Medicare Patrol. If you have questions about your Medicare statement, call your healthcare provider or call your plan. If you're not comfortable calling that provider or not satisfied with their response, call SMP at our 877 hotline number shown on your screen. In addition to reporting fraud, using our toll-free hotline number, you can also visit our website, and the website is www.stopmedicarefraud.org, and click on the orange Report Fraud button. We have lots of different options and ways to contact us. Next slide. Please keep in mind that Senior Medicare Patrol is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basis of Medicare and healthcare errors, fraud, abuse, and scams, in addition to giving presentations and attending community events. Our volunteers participate in bi-weekly webinars and various training opportunities throughout the year. Volunteering for Senior Medicare Patrol is extremely flexible and is done on an as-needed basis. Each volunteer can determine how often they would like to participate. So if you think volunteering for SMP is something you may be interested in, give us a call at our toll-free number and we can send a volunteer information packet and we can answer any questions you may have about that process. Next slide. Okay, if you want to stay up to date on the latest scams impacting older adults in your community, just scan the QR code using the camera on your cell phone to be guided to our social media platforms like Facebook. So we have a Georgia, Louisiana, and Mississippi Spanish Facebook page. Other platforms, social media platforms include YouTube and our podcast, Sip and Learn with SMP on Spotify and Apple Podcasts. Our state-specific SMP Facebook pages are a great resource for older adults and their care partners to find out about hot scams happening as soon as we learn about them from reports called in to us or from our community partners. Next slide. As mentioned in a previous slide, we have a toll-free number at 877-272-8720. You can call to report potential healthcare fraud or to ask us questions about potential fraud, and even to request we attend your event or speak to your group on our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and from invites allowing us to reach older and disabled adults in your community. Additionally, you can visit our website, www.stopmedicarefraud.org, for more information about the SMP program in your state. Our websites can be viewed in multiple languages by adjusting the language tab at the top right part of the screen. Next slide.
All right, thank you, Brenda and Johnetta, for the information on protecting your Medicare today. Coming up next for our webinar Wednesdays in April, we are going to be talking about genetic testing fraud and scams. So don't get swabbed by scammers. Will be held on Wednesday, April 29th at 10:30 Central, 11:30 Eastern. So be on the lookout for registration information so you can join us then and learn about that very important topic. All right, and up next, those of you who were registered to attend today's webinar by 10:15 this morning, your names have been entered into a prize wheel. You do have to be present to win, and today's winner will receive a $25 Amazon e-gift card. So you'll give me just one moment. Let me pull up the, pull up the wheel. There we go. All right, and so we'll give it a spin and hopefully our winner will be on today's call. All right, let's see if Miss Patty is on. And I do not see her name, so we'll go ahead and take her off and give it another spin. All right, it looks like Miss Sherry Warren, you are our winner today. So thank you for sticking around and congratulations on winning our prize for March. I'll go ahead and close this out and we will get back over to our slides if you'll give me just one moment. There we go. So, all right. So now it's time. There's the prize wheel. There we go. All right. Sorry about that. So if you have any questions before we wrap things up today, if you have any questions about the information that we've presented, you can raise your hand and we'll unmute your line and you can ask us. You can also chat any questions that you might have into the chat. I'll kind of take a look at that now to see if we have any questions coming through. All right, well, I'm not seeing any questions coming through, so this is going to conclude our presentation today on Medicare card scams. We will send an email after the webinar today that will have a link to a short survey. We would really appreciate it if you would take just a few moments to let ACL know how we did with today's presentation. We appreciate you joining us again this morning for protecting your Medicare card from scammers, and we hope to see you all again next time. Thanks again and take care, everyone.